And a lot of times with medicine in particular, it's helpful to prep owners when we're talking about a workup that even though we hope the end result is an answer and a diagnosis, so often it's not. It's just kind of the nature of the beast with veterinary medicine. We can spend all of the money in the world and do 20,000 diagnostic tests. And at the end of the day, I may say, I still am not clear what's going on.
Hi, everyone. A very warm welcome back to the Paws Effect Podcast. I'm your host, Dr. Carra, and in today's episode, it's a must listen for any pet owner who's ever faced a confusing diagnosis, a long list of tests, or the dreaded words, we need to do a workup. I'm joined by the brilliant Dr. Nicole Fein, a specialist in veterinary internal medicine, to break down exactly what goes on behind the scenes when we are investigating complex cases. From advanced imaging and lab work to scopes and monitoring tools, we're pulling back the curtain on the process, the purpose, and yes, the price tag. If you ever wondered why your vet is recommending certain tests, and what they're really looking for, or how these tools guide treatment, this conversation will empower you with the answers and help you feel more confident in the decisions that you make for your pet. If you find this episode valuable, please don't forget to like, share, and subscribe, which helps us bring reliable, vet-led information to pet owners everywhere. I hope you enjoy it. I'm super excited to introduce you, Dr. Nicole Fein, all the way from California. Welcome to the Paws Effect Podcast.
Thanks so much for having me.
You're a very busy lady. You are an internal medicine specialist, which is for us general practitioners like a goddess. So I'm delighted to speak to you. Can I start by asking generally what does that mean to the general public and to my listeners, being a specialist? What does that mean?
Yeah, I think basically the difference between general practice and specialty care is just the depth of knowledge versus breadth. I think GP doctors are, I could literally not do your job because you guys are essentially specialists in surgery and dermatology and endocrinology and behavior and dentistry and all of those things. I just happen to have specialty training that's maybe a little bit more advanced, but in one focused area. So for me, being an internist, usually that means the management of more chronic conditions. So things like chronic GI issues, vomiting and diarrhea, chronic kidney disease, liver disease, anything that has to do with function of the internal organs generally falls into the umbrella of cases that I see.
So how, for example, does the role differ to someone who is a surgeon?
So surgeons have a very kind of similar level or the same level of expertise, but just in a kind of parallel universe. I always like to say, as long as I don't have a scalpel in my hand, we're good. I don't want to make any holes, but I'll put a camera in any hole that already exists. So surgeons focus on soft tissue surgery. So removing tumors, things like that, fixing broken bones. It's just a different area of medicine and one that I very happily don't enter into if at all possible.
So in terms of qualifying as a specialist, what is the path? Explain sort of what you've had to do to get to this point.
Yeah, so it's pretty similar to the trajectory of human doctors and their specialties. So for me, I did 4 years of vet school, a year rotating internship, which for veterinarians generally is sort of primarily ER, and then you get to dabble in other specialties, and then followed by a 3-year residency specific to internal medicine. There are some specialties these days that it's getting more and more competitive to specialize. So some people will have an intermediate step and do a specialty internship between their rotating internship and residency. So they're still an intern, but they're an intern within the specialty that they hope to go into. And I know people that have, say, gone into cardiology or things like that have had to do 1, 2, 3 specialty internships. So sometimes the normal kind of 8-year process can become much longer than that even.
And what out of interest is your key area of enjoyment within your role?
I really like endocrine disease. I also really like medicine emergencies, which I know most internists don't enjoy, but my residency in particular was pretty ER heavy. The residents were responsible for taking cases directly that walked in the door that fit into medicine, but were a little more sick. So I think it's really fun to help try to stabilize things like an Addisonian crisis or a DKA or something along those lines. now that I'm a mobile specialist, I don't get to see those types of cases anymore, which is a little bit of a bummer, but it is nice that most of my patients are a little healthier than they used to be. And I don't necessarily love chronic GI signs, but that is definitely the bread and butter. So you kind of come to love it as you practice in medicine for so many years.
So when we were discussing topics for this podcast, obviously, I mean, we could discuss anything. I mean, the cases that you see are so varied. I thought one area that I haven't had an opportunity to really give the listeners an insight into is that whole case workup. Mm-hmm. And there is obviously, I want to just very early on say there's a difference between the kind of workups that we do as general practitioners and that referral workup. But ultimately, the thought process is the same in terms of staging it, managing financial decisions, and so mm-hmm. on and so forth. Can we start off with sort of the term workup? What are we meaning when we say to our owners, we need to work up this case?
Basically, I just think of it as what diagnostics do we need to do to try to get to an answer? And a lot of times with medicine in particular, it's helpful to prep owners when we're talking about a workup that even though we hope the end result is an answer and a diagnosis, so often it's not. It's just kind of the nature of the beast with veterinary medicine. We can spend all of the money in the world and do 20,000 diagnostic tests. And at the end of the day, I may say, I still am not clear what's going on. So prepping people from the beginning for that, I think, is really important. But basically, it just means we've done sort of the initial minimum database type things, typically speaking, with our general practice doctor, CBC, chemistry, urinalysis, those types of things. And we still aren't sure what's happening. So either we need somebody who has the time and depth of knowledge to do more diagnostics, or a lot of times it's just a matter of, I have different equipment that you guys have access to. So the next step is a diagnostic procedure that requires some type of advanced tool, whether it be an ultrasound, a CT scan, an endoscopy, and I have access to those tools and know how to use them.
And I mean, the workup is obviously generally a discussion point that you have a conversation with the owner and say, in an ideal world, this is what I would be doing. Mm-hmm. How often do you find that there are limitations from a financial, even an emotional perspective to say, I don't want to go this far. I'm only prepared to go to this point?
Almost always. Actually, I would say the frequency with which we have a case that comes in that I would say, this is the gold standard, this is what it's going to cost, here are all the tests that we're going to do, and people say, sounds great, let's go for it, is definitely the minority. And I live in an area in Orange County, California, that relatively speaking, globally is fairly affluent, and I still face that all the time. So I know that my colleagues smattered around the world definitely run into it even more so than I do, probably. And that's fine. That's just the nature of vet med and what we're dealing with. And I think it's really important for us to practice practical medicine and to meet people where they are and say, okay, let's be open and honest about what our limitations are. And I think what you said, not only just cost constraints, but sometimes someone says, my dog's 16. And yes, I see this abnormality on lab work, but realistically, does it make sense for me to go down this road to hunt down an answer for something I may not do an invasive procedure to fix or what have you? Maybe that doesn't make sense for the family or for the pet or for both. And that's always totally fine. So we need to get a clear understanding at the onset of where everybody's at so that we can make the best plan that makes the most sense without making people feel guilty or like they're not doing enough for their animal.
And in terms of referring cases onto you, do you find that the pets are passed onto you with the adequate information provided, or is that still something that general practitioners, I'm slightly setting you up here?
That is
loaded question.
Practitioner dependent. There are some places, I used to work in brick and mortar referral hospital, and there are definitely some hospitals that, you see their records get faxed over and you're like, awesome, these owners are going to be set up for success. They're going to know what things cost, how long it's going to take, their expectations are set. And there are other people who kind of anticipate the potential frustration on the owner's part and say, I'm going to let you deal with that. So it really depends. It would be really helpful if we could be better, I think, as a whole of being honest with owners and preparing them appropriately prior to transfer. Because it's not uncommon for me to get a case and say, okay, you walk in the door with the consult. Generally speaking, we'll recheck some blood work and do probably an ultrasound in the initial visit. That's a really common first step. Depending on where you're at, that could be anywhere from like $600 to $1,000 US. And that's a lot of money. And so sometimes I'll get cases that get referred to me and I say, okay, here's where we start. And they're like, oh, I can't do any of that. So if their budget doesn't support the workup, it's probably better spent to stay with your family vet and allow those resources to go towards medication trials and things that may actually make them feel better, rather than spending the money to come and see me and then have to not be able to help. So I think setting people up for appropriate expectations is really important. And we could probably in general do maybe a better job of it.
So some perceptions that vets are very keen when they just have reached the limitation of what they can provide answers for, or their, like you say, the depth of knowledge. How often are you contacted just for an opinion versus having the case handed over to you?
I think for me, I get to interact with referring vets with questions maybe more so than the typical internist, which is actually really awesome because I don't even want to call it teaching because that makes it seem like I know more. And it's just bringing people into my geekiness and love for medicine is fun. But because I travel and go around to different hospitals, I share cell phone numbers and things like that with most of the vets that I work with. So it's not uncommon for me to get texts like, hey, I have this case. Do you think it's appropriate? Should I send it to you? Or can you help me out with these lab findings? And I think every internist that I know at least is happy to do that and would encourage that. I think two minds are always better than one. So if you know someone who's an internist and you're a general practice doctor, like, please don't ever feel embarrassed. I feel people have told me before, oh, you're so smart. I'm like, not really, actually. I just happen to know about this one thing. You know about all of these other things. So feel free to call, text, ask for help. We can collaborate, and that can sometimes get the pet a lot farther than just shuffling them off to our office.
Yeah, particularly if there are constraints.
Mm-hmm. Yeah, absolutely.
Yeah. Hey there, pet parents. It's Dr. Carra, the Ultra Pet Vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultra Pet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultra Pet offers 100% money-back guarantee. Try Ultra Pet's premium recipe for short-muzzled dogs today. So I wanted to take the opportunity to discuss some of the tools that you use in order to get to a diagnosis, ultimately for the listeners, so that they can see my thought process here, because and you made mention of it right at the start that you may do a whole series of investigations on a pet and still not get to a diagnosis. However, when we start even with basic workups, and we consider that from in our consult room, taking a history clinical exam and collecting the findings that are presented in front of you to advising that the pet, for example, needs blood work. Can we talk about blood work and the importance of it, and it not being a waste of money, for example, if things come back normal?
Yes,
because that's often a very resentful moment, because we say, well, there's nothing, I can see no abnormalities here.
Yeah, I run into that obviously all the time, and I try to frame it as great news. We have ruled out so many things. Your pet is not diabetic. Your pet does not have Addison's disease. Your pet does not have kidney disease. Your pet's liver is functioning. Look at all this information that we've gained with these normal results, rather than trying to focus on, we still have no clue why your pet feels crummy. And I get the frustration. You walk in, you spend a lot of money, and especially as the process continues without answers, And, we're not doing these in times when the pet's feeling well. Usually the owners are worried their dog, cat, whatever it is, doesn't feel well, and they want to get an answer so that we can start to get a fix. So I understand the frustration, but normal diagnostics are actually super useful. And it makes more sense to roll things out progressively rather than walk in the door and just run a battery of tests and then have all this information you have to sort through. So we just have to go stepwise.
Yeah, absolutely. I mean, the nice thing, and I always try and explain to owners, is that, it means a lot to us, even in terms of, I know I can use these medications, whereas before I may have been hesitant to do so. So, but I can appreciate sometimes, having a finding or something to feedback can feel more reassuring, particularly because there's now a delay in actually figuring out what's going on. So blood work is often where we start. But I also, you do a lot of ultrasound and endoscopy and rhinoscopy. And I'd like us to discuss those things because I particularly like the fact that they're non-invasive.
Yeah.
Can you explain to my listeners what I mean by that and what these help you find and sort of the purpose of them within your workup?
Yeah. So absolutely right. I do, because I'm a mobile specialist, I do ultrasound and endoscopy essentially exclusively. There are very few times where I have a consult that doesn't include one of those tests. So starting with ultrasound, most general practice hospitals have access to x-rays, which is a great kind of preliminary imaging modality, but ultrasound is going to give you just a lot more detail. With x-ray, you see shades of gray, but things overlap, and you might be able to say, okay, in this area of the abdomen where the spleen, the liver, and the GI tract overlap, it looks like there might be a mass. But with ultrasound, I can say there's definitively a mass. It's coming off of the tail of the spleen. Here is where it is. This is what it looks like. Therefore, this is what it might be. And so we just get a ton more detail. You can't see the thickness of the GI tract on x-rays. You can quantify that and measure that on ultrasound, and all of that information is helpful. And then as far as endoscopy, that has kind of a twofold benefit. With those tools, whether it be rhinoscopy in the nose or endoscopy in the GI tract, you get to see the lining or the inside of the tissue, which even with ultrasound, we can't appreciate. But more than that, it helps to facilitate collecting samples from those areas. But we can do them, and like you said, non-invasively. It doesn't require an incision. They don't have to go home and wait 14 days for the sutures to heal. They don't have to have a cone on. Most of the time these pets come in, they do have to undergo a brief anesthesia, but we can get actual tissue samples to send to the lab to get definitive answers. They wake up, they go home that same evening, and they feel fine. And it does sometimes surprise people to even know that we do things like that in dogs and cats, because people will get a colonoscopy or something like that. And I'm like, yeah, I do that in cats all day. And they're like, wait, really? But it is a great way to get adequate tissue samples to get a definitive answer without causing any significant kind of harm or trauma to the patient.
So when you're advising, let's say to do an ultrasound, often there are limitations as to which organs you can look at or which area of the body you can look at with an ultrasound. Mm-hmm. Explain that to my listeners, please.
So ultrasound is, in my opinion, the best for imaging the abdomen. The tricky part with ultrasound when it comes to the chest is that because of the physics of ultrasound itself, air or gas deflects the beam. So you can't see anything past where the air meets the probe. And so in the chest, for example, normal healthy aerated lung has gas in it. And so when you put the probe there, you don't see past it. So there might be a mass or an enlarged lymph node or something in the chest that we can't see because you can't see past the air, versus an x-ray would be able to take a picture of it. With the abdomen, you should not have any free gas. And if you do, that's very problematic. But most times you're not seeing that. And so you can get a really clear picture of all of the organs inside. And so for that reason, it's a great modality to image the belly.
And there is quite a systematic approach when you're doing an ultrasound. I think a bit like owners watching us do a clinical examination, not realizing all the information that you're getting from it because you're chit-chatting. Mm-hmm. They're like, I didn't even see you take that temperature. Yeah. In the same way, it is a very systematic sort of approach that you do in order to rule things in or out, mm-hmm. and cover all those organs. Talk us through sort of your approach to it.
Yeah, so I was always taught there's no right or wrong way to do it as long as you do it exactly the same way every time. So some people always work through the organs counterclockwise. Some will start with the GI tract and then go the other way. And it doesn't matter. It's just to be, like you said, systematic about it so that you make sure you check every box and you look at everything you need to. So I go in a clockwise fashion. I start with the liver. I'm going to evaluate the size, the brightness. Are there nodules present? What does the gallbladder look like? Is there sediment in it? Then I move over to the spleen, look at the same kind of things, left kidney, left adrenal, bladder, right kidney, right adrenal, and then do the stomach and then track my way through the GI tract. And as long as I go kind of in that pattern every time, I know that I can see all of the things I need to. And certainly every pet's going to get a complete exam, but if there's something in particular that we're worried about, I'll hone in and spend a little extra time on the organ system that we suspect might be a concern. Like if the dog we're screening to see if it might have Cushing's disease, I'm going to really make sure I get a really clear view of both adrenal glands in entirety.
Absolutely. And I mean, there are things that you may be measuring if you're doing that with experience and the fact that you are a specialist. Perhaps general practitioners are just not at the point of doing it unless they have a special interest.
Yeah, absolutely. I think, and it just, for ultrasound in particular, it's not a difficult skill per se to learn. It just takes repetition. And so I think that there are some general practice doctors who do it quite frequently, especially those that might be in areas that, the nearest referral hospital is farther away. So it's prudent for them to learn how to do it. But unless you're doing 5 a day for years, it's difficult. And there are still times where I take a video of the screen and send it to my other internist friends. And I'm like, phone a friend, help. What the heck am I seeing? Because it's not perfect. And sometimes you see really weird things that you don't expect. But I definitely think that the more you do it, the better you get at it. And to your point, most of the normal measurements are just in my brain. So I can usually look at something and already tell it's a little bit on the plump side and appreciate those subtleties that somebody who doesn't do it every day may not notice.
And then in terms of the difference between what you're doing there, abdominal and the cardiac scan, just for the benefit of people who don't understand this.
I don't go anywhere near the heart unless I'm just looking to see if there's fluid around it in a patient that's really sick. Otherwise, the heart is so dynamic because you're measuring something that's moving. And so you can very easily, if you push freeze the image, on the improper timing of the cardiac cycle, it can make the muscle look much thicker or the lumen look much bigger or smaller than it actually is. And so echoes, I feel, really should be done by cardiologists or somebody who does them all the time and knows that they got the appropriate training. Because even I know I'll look and I'll be like, oh, I think that left atrium might be a little plump. And then the cardiologist is like, you're fine. It's totally normal. Or you measured it in the wrong angle, so it looked twice the size or whatever the case may be.
Now, owners seem to get very acceptant of the fact that their pets are shaved when they have to undergo a surgical procedure, but they are often not communicated with when they have to be shaved for an ultrasound. Can you explain why?
Yes. It's it's 100%
clipped.
Absolutely mandatory, necessary. And I agree for some reason, like, if they're having surgery to fix a fractured knee, they expect them. But I've had people be like, it's a show dog. Can you leave her belly fur? I totally would if I could. But what happens with ultrasound is you have to have direct contact to the skin. And so, like I said, air or gas reflects the beam. And so anything that you have that's going to leave little pockets for air is going to make the image fuzzier. So when you shave the belly, we then spray it down with alcohol to really wet it to get rid of all those air pockets. And then we put ultrasound gel on top to try to make the connection between the probe and the skin as direct as possible and to eliminate as much air. In any kind of fur, if you leave it dry, there's going to be interaction. And a lot of times, if you think about like Huskies or Akitas or other dogs with full dense coats, you put the probe onto fur and it's a black image. You can't see anything at all. So it really is something that we just kind of have to do. And a lot of times with bigger dogs, their kidneys are like way up in their back. So the owners are like, I thought its belly was going to be shaved and you've got this like big open circle, but we just have to remove the hair where the organs live. And that's kind of dog dependent. So
It grows back.
Yeah, it does.
but I can understand the horror
I know,
when owners are not prepared for it.
They have like a little mohawk sometimes because they're shaved like wide on the side. Yeah. Sorry.
Tell us about the ability to collect information using an ultrasound probe. Sorry, what I mean by that, just for the context of my listeners, is doing any biopsies or any needle aspirates.
Gotcha. I love to do FNAs of things with ultrasound guidance. That's also a skill that just takes repetition and getting really comfortable with being able to follow your needle. For any primary care vets out there, I would say as long as you can confidently see your needle through the entire path, it's safe to do. But a lot of times, even with just cystos, like collecting a urine sample, they use the ultrasound and you'll see the initial poke, but then you lose the needle. And there are things in the belly that it would be bad to poke, right? So like making sure that you're really seeing that clearly is super key. But as long as you feel comfortable doing that, and at this point I do, if I could see it with the probe, I can try to poke it, and you can usually get cell samples and a diagnosis in a lot of cases without having to need even endoscopy, let alone surgical biopsies. So if there's big lymph nodes, masses in the spleen or the liver, I can aspirate the kidney, even the adrenal glands in some cases, which is a little bit scarier. So you can really get a lot of information with a test that's quick little needle prick. And oftentimes we'll give patients a little bit of sedation anyways. It's not that it's painful per se, but they're already nervous and laying on their back, really tense. And so if they're relaxed, we're relaxed, everything goes faster and smoother. So we can get a ton of important information in 15, 20 minutes, which is awesome.
That's incredible. And unlike your rhinoscopy or endoscopy, as you mentioned, you don't necessarily need a full general anesthetic. You can do these patients just mildly sedated if they are tolerant of it and if they're amenable.
Yeah.
That also is a great benefit for going home or recovery, or particularly if they're not well.
Yeah, absolutely. Yeah, there's a lot of patients that anesthesia makes you a little bit nervous to have to do because of how ill they are. And so if we can get an answer without doing that, that's preferred, certainly. And anesthesia is usually a big bulk of the cost as far as the diagnostic test is concerned. And so eliminating that enables us to get an answer, whereas in other cases, maybe we wouldn't be able to do the procedure, not even because of risk or concern, but just because the expense starts to really ramp up anytime anesthesia is needed.
Yeah. So take us through the process of using a scope in order to complete your workup.
Yeah. So scoping is so much fun. I think of it kind of as those like claw machines in arcades that you used to play when you were little, where you have to turn the knobs. And there's definitely a learning curve, especially because I didn't grow up playing video games or anything like that. So just holding the equipment was pretty cumbersome at first. But basically, the pet's going to undergo anesthesia. And this is not because it's painful. It's just they have to be still for a prolonged period of time. And you know, we have to make them swallow something that obviously they wouldn't do awake. So for GI endoscopy, which is the most common type of endoscopy that I perform, we intubate them under full anesthesia, just as if they were going to have any other procedure, dental surgery, whatever the case may be. And then we take the camera. It's connected to two different knobs that control the angle of deflection, and then a really long tube. And that gets inserted into the mouth, down the throat, into the stomach. We usually look around in the stomach, and then we go into the duodenum, so the first part of the small intestine. Once we visually inspect those areas, then there's a separate channel that runs through the scope with a little biopsy grabber. It's on the screen, it always looks like this like big claw of craziness, but it's really teeny tiny actually. So the tissue samples we get are millimeters in size. So we feed the biopsy grabber through the scope, and we go out and we can actually take little samples. So we'll get those from the small intestine and from the stomach. And then depending on the case, sometimes we'll flip the pet around and do the same, but in reverse. And obviously we start with the cleaner side and end on the messier side. Rhinoscopy is similar. The scope we use is a little bit different. So instead of being a flexible tube, generally speaking, we're using what's called a rigid scope. So it's a long, hard metal sheath. And we just feed it in the nostril and kind of maneuver around all the different nasal turbinates, because the nose is a really kind of maze-like windy pathway in there. We look for fungal plaques. We look for if it's more red or more pale, if it looks puffy, edematous. And then same thing, we feed some grabbers in and we can get little tissue biopsy samples.
So what happens with these samples? What do you do with them once you've got them?
So we send them to the pathologist. They'll make microscopic slices and put them on slides and evaluate the tissue. And then what the pathologist will tell us is what types of cells are present. And based on what types of cells are present, that enables us to decide what type of disease is occurring. So are there cancer cells present? Is there an infiltrate of lymphocytes? Does the cat, for example, have GI lymphoma? Are there a certain type of inflammatory cells that would be more consistent with inflammatory bowel disease or food allergy, things like that? And so when we have the actual tissue samples and the pathologist telling us, okay, these are the cell types that are present, then we have our definitive answer.
And obviously, in terms of your workup, how do you make a decision about which modality to start with, whether to start with ultrasound, if you feel possibly both are needed?
I usually escalate up from least expensive, least invasive to most, because if we can get an answer sooner, that's better. And there are certainly times that we do. And the other thing to keep in mind is it's not just like a linear path of this test does the same thing, but a little better. And this one does the same thing, but a little better. There really are certain things that you get from one that you can't get from another. And so they often work better in combination than in isolation. So with ultrasound, for example, when I'm doing an endoscopy, I put the scope in, all I can see is the inside of the intestine, and all I can see is the inside of intestine for the length of the scope that I have. Once the scope is all the way in, there's still feet of intestines that I can't evaluate. So if the problem is there, I may not see it. The biopsies may come back normal, everything looks fine, and I'm like, oh, that's weird, we didn't get an answer. I might ultrasound that same pet and find a large mass in the intestine right in the area that the scope couldn't reach from either end. And so in that way, you really do need both. And so I usually will start with the ultrasound, because if we see the mass, we know maybe we don't need to go the next step to endoscopy. We've already gotten our answer here, and the pet needs surgery to take the intestinal mass out. And so I want to make sure that there's no contraindications or things that we find that might change our plan before we step up to a much more expensive and a little bit more invasive test.
Can we talk about the limitations of some of these things and when you may be suggesting things like an MRI or a CT scan?
Yeah, I think for me, I can usually get the information that I need from the ultrasound. That being said, a CT scan is certainly going to give you more detail. The main time I think that I'll reach for a CT scan is if we're sending them to something to follow up beyond the ultrasound, if we're not going to stop and start treatment. So for the most part, that would be either advanced treatment like chemotherapy if we find a cancerous process, or if I know the pet needs to go to surgery. So for example, if I find on ultrasound a liver mass and it's in a location where I can't get a really clear picture of the whole mass just because of the rib cage or whatever the case may be, and the owner's like, we want to do everything, we're going to go to surgery, we're going to take this out, I'll probably recommend a CT scan to get a more thorough, clear, full picture of where exactly that mass is. Is it amenable to surgery? Can it be resectable? It lets the surgeon have kind of a game plan going in. So in that way, the follow-up test is really necessary. If the owner says to me, that's a really sad finding, I'm sad that my dog has a tumor, we're probably done, I'm not going to recommend the CT scan, because for me, the point of a diagnostic is should only be run if it's going to change what your plan is moving forward. There are some people who information is power. And if they're an owner who says, I just want to know, I know I'm not going to do anything with it, but I just want to know, that's also really valid. But as far as pushing a test and more strongly recommended, for me, if it's not going to change my treatment plan, then I don't recommend doing it.
No, I agree with you. Now, we've spoken about the heavy stuff, the very specialist stuff. There are obviously tools that you use like an otoscope or a blood pressure machine in order to gain information. Tell us about some of the other useful things that you're able to sort of extract information from to determine outcomes.
Yeah, I mean, being in medicine, I just want to do all the tests all the time because I love the information. If I have a hospitalized patient, like in my ideal scenario, I'm like, okay, I want to check its electrolytes every 10 minutes, but obviously that's not real life. I think blood pressure machines are ones that we underutilize, but I also totally understand that getting an accurate blood pressure in a dog or cat is not something that is super easy to achieve because they're almost always nervous and ramped up in hospital. I don't have many other interesting specialized tools, but we definitely do a ton of additional blood work beyond just the general CBC and chemistry. So usually, for the most part, a patient that gets referred to an internist has already had most of that minimum database done. I may want to repeat it because a prolonged period of time has gone by, or I want to see if the values have changed and what does that tell me. But then we're also doing hormone assays and infectious disease testing and other laboratory kind of more specialized panels that help to add information to the overall picture.
No, that's very useful. I think that some of the misconceptions are that, repeating tests are just in order to generate more money. But they're so valid that things can change within hours, which is why you commented on running electrolytes frequently. Even within a few hours, things can change. We have situations, for example, where we have a pet and it's maybe doing absolutely fine, and the night vet will update the owner, and by the next morning, not wanting to necessarily bother, but there has been a change in status, and that information is needed in terms of repeating tests or diagnostics. So very, very valuable because things change, especially
absolutely.
in our pets.
And time is, they give the rough estimate that, 1 year in a pet's life is 7, 8, 9 years. And so an owner may reasonably say, we just did this 2 months ago. But if your cat is 16, 2 months is actually a pretty long period of time. So knowing where they are now is actually really important information to have.
Yeah. So how regularly would you advise pet owners go and see their vet and have checkups?
I think it definitely depends on the patient and if and what types of conditions we know that they have. If you have a general healthy pet, I think yearly blood work is really totally sufficient for young and adult patients. Once you start to get into senior age, so somewhere in the 7, 8, 9, depending on the size of the dog, certainly 9 in a little Chihuahua is different than 9 in a Great Dane. But once they become senior for their signalment, in an ideal world, I would probably increase it to twice yearly. And then if they're diagnosed with a condition, that could easily increase significantly. So if you have a patient with chronic kidney disease, I think every 3 or 4 months is more appropriate. And as things start to progress, maybe even every 2 to 3 months. If you have a disease like diabetes or Cushing's, where you're needing to do monitoring to assess response to medication, that sometimes is every 4 to 6 weeks at the beginning until we get things kind of settled and cruising and on a good place. And then you can stretch out the frequency after that. But definitely as patients get older, prepare to need to see your vet more frequently.
Absolutely. I'd like to discuss the work and the role that you play on social media, because I think the information that you're putting out there is firstly very relatable. Thank you very much. Really relevant. And, it's starting to break down some of the barriers between pet owners and vets, which I think is really, really important. Why are you on there? What drives your presence there?
Well, first of all, I've always been kind of a comedian and like the funny friend, and people have always like, you should do something with that. But I felt like there needed to be a way to make things feel more accessible for owners. And I think humor is a really good way to kind of relax people and bring the walls down. So that seemed like an obvious outlet. And I didn't feel like there was a really strong presence of specialists versus general practice doctors. And so I thought that was kind of a unique area that I could help to inform people. I really enjoy teaching. So I've had a lot of fun making the content that focuses on, a particular disease and breaking it down. I think medicine is a specialty that for some reason amongst is kind of daunting sometimes. And for me, it's so much fun. And obviously I'm biased because I do it every day. So it seems easier because I'm so familiar with it, but I really don't think it has to be this big, scary thing if you really break it down to the fundamentals. And so sharing that is really cool. And I also, have definitely, unfortunately, in practice, run into clients who don't understand the necessity of it or understand why it costs what it does. And so trying to kind of break down that wall and open the door to let them see this is what's happening behind the scenes. This is all the work that's going into it. Here's, why we're doing this, I think can be really helpful and might have the potential to have patients get access to that care that maybe they wouldn't have otherwise.
Absolutely. Do you think it's making us a little bit more accessible?
I certainly hope so. I think everything's a double-edged sword for sure. I think everyone now has an opinion and loves to share it, especially behind the safety of their keyboard. But fundamentally, I think the people that I've met in the limited time that I've been on social media have just been absolutely incredible. This little community of Vetstagram, we call it, is an amazing support system. We all have side DMs and text messages, and we're all really trying, I think, to put a better face to the profession and to make people realize that we're so genuinely just here to try to help your pet. And I don't know a single person that's in the money, and if they're in it for the money, and if they're doing it for that reason, they've picked the wrong job. And I don't know if people out there really understand kind of what we get out of it versus what we put into it. And so it's been awesome kind of to step into this world a little bit.
And what do you think the reason is that pet owners are not trusting professionals anymore?
Oh man, that is also a loaded question. I don't know the answer, to be honest with you. There's a disconnect between being able to make the connection between what they go through when they go to the emergency room and what happens with their pets. And that's something that's always kind of not really made sense to me. I can't remember the last time I went to an ER and was seen immediately. You're just going to wait. But then in our ERs, we have people who are losing their mind over it being 20 minutes. And I'm like, you've been to the hospital too, right? This is how it goes. Or the cost of care. We see what our medical bills are, and we don't even see what they are before insurance. It's just this stuff, unfortunately, is expensive, and we don't, in so many of the cases, don't set the costs. A lot of times aren't making production off of things, but there's still this feeling like we're just trying to steal from them or suck as much cash as we can out of them, and it devastates me that opinion exists. And I honestly don't really understand where it stems from. So I think we just need to continue to try to be as open with pet owners and do a better job of showing what we're doing and why this is the value that it brings. And hopefully gradually with time, the trust will come.
Absolutely. And I think the fact that there are vets who are putting themselves out there and showing that they're human, that they're real people behind all the work, that, the face of what we're doing is really valuable. The moments of, sharing something that really resonated, whether it's happy or sad, and the joy that we get from the work that we do, but also some of the struggles that we face. And it's nice to have that support system, as you say, because if it's resonating with you, you certainly know that the whole community of vets are feeling the same worldwide. Yeah. So in terms of where people can find you, where can they look for you? How, if we're vets who want a second opinion, obviously you're based in the US. So in terms of rotating around, you do that locally. But do you offer consultations for veterinarians wanting to get in contact or get an opinion from you?
I don't have anything like that set up at the moment. And I think in the future potentially would. As it stands, I would hate to kind of put that out there and then just not have the bandwidth to adequately answer those questions. And a lot of times too, I need to see all 100 pages of the previous diagnostics in history and really look through that. So that being said, certainly if someone wants to shoot me a DM on Instagram, they're welcome to. It's just, it may not be an immediate answer. So if have a case that they're like, what do I do? I'm probably not the person to ask for that. But if there are overall concepts or subject material that they're interested in, that they would want maybe like a reel or something like that, that would be something I would be really, really interested to know. So my handle is at dr.Nicole Fein, Nicole Fein. So definitely let me know if there's particular internal medicine topics that interest people that they'd like to know more about.
Absolutely. Well, I think it's a minefield for most of us in terms of some of the things you're right, we do when we reach our limits with a case, you kind of feel really out of your depth. So very grateful for specialists like you. Very pleased that you're representing the field on social media. Thank you very much for the work that you do. And thank you for taking the time to have a discussion with me. It's been so appreciated. And hopefully people can get a bit of insight into the work that you're doing and why we may be referring cases and the benefit of doing so in the interest of the pets.
Yeah, absolutely. Thanks so much for having me.
Thank you. Thank you, Dr. Nicole. Thank you so much for tuning into today's episode on the Paws Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Carra.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can I get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.